Hello, my name is Ron Eslinger, and I'm here to talk to you about hypnosis and pain management. I'll tell you a little bit about myself. I am a retired from the United States Navy. I retired about 12 years ago, and when I retired, I chose to do hypnosis rather than what I've done since 1975, which was anesthesia. I am a nurse anesthetist. I found out that it was a lot more fun, a lot more relaxing, and I actually felt retired because I was doing hypnosis and not anesthesia. So in 1975, when I retired from anesthesia school, at the hospital that I took a job at, there was a new doctor that came in. He decided to specialize in high-risk pregnancy, and I had just finished a hypnosis course. Not meaning to become a hypnotist, I just wanted to get some continuing education credits, but I found that it fit so well, so continuity-wise, with me doing anesthesia, that I just used it with every patient I did, going to sleep, waking up. But he came to me because I had done some other work with him, and he heard me talking to my patients, and wanted to know if there were some things that I could do with his high-risk pregnancy patients, because this was before epidurals and before even safe spinals. So therefore, I said, sure, I'd love to. I wanted to get that experience. So not only did I work with the high-risk OB patients, the one up in childbirth, but I also started working with some of his surgical patients that were high risk, maybe heart patients, and I was doing just hypnosis as a part of my anesthesia, or as my anesthesia, back in the late 70s. And that was kind of how I really got started and got to be known. And people started asking me about doing so many different things that I opened my own practice. So I have actually had an office in hypnosis, even when in the Navy, from 1979 up until this date. So I've been doing this a long time. I've got a lot of experience. What I want to do is to share all of these years of experience with you, and also to keep you in mind of the fact that you can't just do pain management, because a lot of these patients and clients are going to have other things going on. So when I'm doing weight, I may also do smoking, because if a patient is a smoker, that nicotine is going to increase their pain. So those are the things that you can learn how to do. You can do it extremely well with practice and experience. You got to learn how to read a lot of books, study a lot of programs. I've even got an online program out there on how to do hypnosis for pain management. So there's lots of ways to learn, but you got to be reading every day. You've got to take care of yourself, knowledge-wise, experience-wise, in order to take care of your clients. I retired from the Navy in 2004. Instead of doing anesthesia, I decided I'd like to open my own wellness center using hypnosis. And when I did that, pain became one of my standards that I worked with, chronic pain management. And at that time, I was also still teaching hypnosis and teaching pain management courses. So I became one of the few in the East Tennessee area that was doing pain management. But we also got very involved in very specific types of pain, such as CRPS, which is complex regional pain syndrome, or also known as RSD. And we have CRPS patients come from all over the country. They come here, we do an intensive, they spend a week in our program in order to go back feeling comfortable, feeling in control, and knowing how to use self-hypnosis. So by specializing in pain management, there's many things that have occurred to me, but you can't just do pain management. I'm a general hypnotist. I have people who come for me for pain, but they also need to stop smoking in order to make that pain do better. I have people who come to me because to lose weight because they've got pain in their knees and they want to have surgery to have total knees. So when you're working with pain management, it also goes in the smoking, the weight, anxiety, and stress. They're all married together, so what we want to do is to treat the whole person, making it a holistic process. So why would you as a hypnotist want to add pain to your program? Well, let's talk about the need. One of the needs is the fact that over 100 million people in America are suffering from chronic pain, and they're seeing doctors for pain, but very few of them are getting any major relief. The other thing is the amount of money that's being spent on that is about $560 billion up to $635 billion annually, and that's just in 2010 dollars. What about the fact that over $297 to $336 billion are lost annually to employees? So not even counting all those other billions. Now this is just to people who can't go to work, and when they can't show up to work, or their insurances are costing companies a lot of money. Those companies are looking for you. Those family members are looking for you. They're all looking for a way to feel better, and hypnosis is a great answer to that process and that program. Now, just because a client comes for hypnosis don't mean you can put them in a chair, do a hypnosis session, and say, you hurt no more. It doesn't work that way. It's not a miracle, and it is work. And one of the things that you have to look at is everybody doesn't go deep into hypnosis to where you can create anesthesia or glove anesthesia. So therefore you have to learn and understand that the suggestions that you give to these clients, those suggestions have to be accepted. So I never worry about how deep my clients go into hypnosis. I never worry about whether or not I can get glove anesthesia. What I am concerned about and what I do work with is the fact that if I make a suggestion, whether it be a direct suggestion, whether it be a metaphor, whether it be an embedded suggestion, that they're willing to accept that suggestion without thinking stuff like, well, I sure hope this works, which is a negative. Well, I'm going to try this, another negative. And then the other thing when you're working with these clients is once they leave your office, they're going to go back home and they're either going to do self-sabotage or they're going to be sabotaged by the family. I had a young lady who came for CRPS. She did great. She was here for a week. I saw her 4 hours a day, 2 hours in the morning, 2 hours in the afternoon, all week. She had had 6 years of multiple surgeries, going to other countries, doing all these things just to be able to walk comfortably without a cane, without a walker, without a wheelchair. And she gets better. She goes home. She is so happy. And she walks in, her family says to her, so it was all in your head anyway. Well, that just devastated her, and everything started coming back. Luckily, she was smart enough to realize she needed to call and say, okay, what do I do now? It just came down to the fact that in many cases, people will try to sabotage because they don't understand how hypnosis works. Now, the other thing I found out, that the more highly hypnotizable a person is, the more likely they are to have problems because of their own self-talk. I spend a lot of time with my clients on how do you talk to yourself? How do you visualize yourself? How do you allow yourself to make the changes in your life? So there's a part of your brain called the cortex. That's this part, the thinking part. It also has all of those things that have happened in your past. And when you think of your past, the brain doesn't know you're thinking about your past. As far as it's concerned, it's happening right then. If you want to get an example of that, just think about eating a lemon and how it makes you feel right here. How eating that lemon changes biochemical and physiological responses in your body. So the brain thinks you're actually eating the lemon. So one of the things we have to teach people to do is how to live in the present. Because every thought of the past is going to create and release those chemicals in the brain that had to do with that sensation, whether it be happy, whether it be sad, whether it be hurtful or harmful or chronic pain. It's going to bring those same sensations back. Try it. Think about something that somebody has done to you that made you angry. And the chances are you probably started feeling that anger again. So I work with a lot of forgiveness. I work with a lot of letting go of guilt. These are the things that when you get into it with these people, they start changing who they are. Whatever a client is thinking when you're giving suggestions is going to override your suggestion. So giving the right information, getting the right information from the client are the things that you want to be able to do in order to have a good rapport, but mainly in order to know how do you speak to the client. I do something called an MBTI. I let the clients fill this out, and when they do, I get a good idea of what their personality type is. By knowing their personality type, I know what things stress them, I know what excites them, I know what makes them feel good, I know what the key words are. So I can incorporate those words into my suggestions to them, my stories to them. Hypnosis is effective in all types of pain, but we're going to talk mostly about chronic pain, because those are the pains that people have had over 6 months. There's no reason that they can find that that pain is there. They keep medicating them, but they do not get any better. So what we want to do is help them to learn how to self-medicate, but not alcohol, not drugs on the street, not heroin. We want them to medicate from the most powerful pharmacy that is known to man, and that is in the human brain. There are 3 pain-killing drugs, chemicals, that are released by the brain. And you can easily release those by being happy, by being joyful, by smiling. But the easiest and most profound way to do that is to take a simple, easy breath. And all you do is push out your abdomen, creating a drop of the diaphragm, which creates a vacuum, which sucks in oxygen and air, and then it opens up the 2 lower lobes of the lungs, which then means a lot more oxygen can get out to the cells, because the 2 lower lobes of the lungs have a lot more blood vessels, have a lot more air sacs called alveoli, and oxygen is healing, and oxygen is relaxing. Oh, and by the way, oxygen is also necessary for life, so not a bad thing to do. However, something else happens when this diaphragm drops. When that diaphragm drops, it tugs on the vagus nerve. When it tugs on that vagus nerve, guess what? That activates the release from the brain. Endorphins, which are your opioids, melatonin, which are your sleep aids, and serotonin, which are your mood elevators. And all 3 of these have 2 other names. One is anti-stress hormones, and the other is pain-killing hormones. Such a simple response. And what I've also learned is when you teach a client to do that, about 1 to 3 of those breaths will automatically put them into hypnosis. So it's a good way to go to sleep at night. It's a good way to use prophylactics, especially for headaches. How many people here said, oh, I feel a headache coming on, and they get one? Well, instead of saying, I feel a headache, it's a lot simpler to just do what? Take that breath. You're going to breathe anyway, may as well make it a very productive breath. One of the things I'd like for you to remember, there really is no pain until it reaches the brain. It's just an electrical impulse when it's coming from anywhere outside the spinal cord. It's just an electrical impulse. Then when it gets to the spinal cord, to a place called the dorsal horn, it is then transferred like at a transmission state into a neurotransmitter. And then it goes up to a place called the thalamus gland, and then the thalamus gland filters it and sends it, depending on what your emotional state is, to different glands, and then that will determine how severe that discomfort is. So just keep in mind, until it gets to that part of the spinal cord, it's just an electrical impulse. And we know, we've touched something and jerked it back. That goes to the spine. That doesn't go to the brain to get that to happen. So how does hypnosis keep pain from reaching the brain? It's almost in the same way that if you bump your shin or bruise yourself, if you rub it, it starts feeling better. It puts up a block within that process, a chemical block. Chemicals are released when we do hypnosis. For whatever the brain has ever experienced or the mind has ever experienced, it can recreate. So if you've got probably 30% maybe of your population can actually numb their hand. We call that glove anesthesia. And then they can transfer it to other parts of their body. Some people say, make it totally numb. Well, they can still feel touch, so that creates some disbelief that it could really work. So I would usually say that no matter what I could do would bother you, but there's 3 things you can say to make that work better. Remember what it felt like when you got your hand really cold. Remember what it felt like in your jaw and your tongue when you got back home from the dentist. Remember what it felt like when your arm or your leg have gone to sleep. Recreate those sensations. And then you can move that to that part of the body. However, that is only temporary. It's like putting a Band-Aid on it or taking an aspirin for it. What you really want to do is to get in and find out, okay, why did they create this process? I had a person who was on a motorcycle. He got T-boned. He's in his early 30s. He lost his leg. He's in his hospital bed. Of course, he's angry. He's upset. He's mad because here's a young man, a motorcycle rider, now he's lost a leg. So a nurse comes in and says, what do you want us to do with your leg? I mean, do you want us to incinerate it or do you want to keep it for burial? What do you want to do? Of course, he's angry. He lashes out. He said, just trash it. Throw it away. Well, the next day his sister comes in and she asks him, she says, what did they do with your leg? And he said, I just told them to throw it away. She said, oh no, now you will have phantom limb pain, which he did. Of course, anytime you're in an altered state, which anytime you're in a hospital you are, so it don't matter if you're a patient, you're more susceptible to suggestions when you are in the hospital or had a procedure. So what was interesting with that was, here he is, angry, makes you more susceptible. In shock, more susceptible. And his sister said that, so then I get him for phantom limb pain later, because being in the military, I've done a lot of phantom limb pain work, and I'm amazed that every single person I've worked with, the pain's gone away. It just always amazes me. I think that's why I still do this. It's just exciting to see people take care of themselves. Explaining that it's all self-hypnosis. So what we want to do then is look at the fact that people have got to quit worrying. Well, that's not going to happen. But keep in mind, worry is self-hypnosis. So that is a part of the treatment plan or part of the suggestions that you put together for those clients. You've got to learn how to talk to the client to get information that's pertinent to what they're doing. So you've got to guide and direct that talk. You have to have a good interview. The way I get my script that I'm going to use with my client is I feed back to them what they tell me. What's your problem? What are you doing about your problem? What has worked in the past for this problem? How does it make you feel? Those are the things that I do, and then I just take whatever they tell me and turn it back on them. If they said something feels good, I want to know why, we'll go back to that time. But I do a thing called cell memory. That is, go back before the pain started and let that area of their body, whether it be a phantom limb area, whether it be a back pain or a headache, what does it feel like before this started? What did it feel like? And those are a lot of what you can do to make this learn. I don't worry about the depth of hypnosis. All I worry about and all I work on is that they're willing to accept the suggestions, because even if they're in the deepest depths, somnolenic, go to an Aaron stage 6. If I say something to them that they're not ready to let go of because they're getting some kind of reward or secondary gain, then they're not going to let it go. So you've got to also work with that secondary gain. They all have some reward. They may not know they're getting a reward. It's up to you as the hypnotist to help them uncover that. I had a client one time that was sent to me by one of my doctors. He had done a really good job. I did grand rounds, and he would use hypnotic language with his patients, and a lot of them really got much better. He just loved it. But this was a lady who for 2 years had migraine headaches. And her migraine headaches started after she had Louisiana encephalitis or meningitis. And she had these terrible, she was carrying around a big old bag of medications. Put her into hypnosis, just treated her as if she was the one who could take care of it. Whatever she said it felt like a vice. I said, then it's time to unroll the vice. It felt like somebody hit me with a bat. Then let's change that bat from a hard bat to just a soft bat. I was totally not expecting that her pain went away the first session. So she missed her third session. I did 2 sessions with her. She missed her third session, so I called up her doctor and I said, have you seen her? She said, no, but I came into the office one day and on my desk was a big old bag of her medication. She left me a note, said, I don't need these anymore. So I'm assuming she's still doing good since she never came back. But I got a call from her doctor from Monroe, Louisiana. And it kind of scared me a little bit because he said, what'd you do to my patient? I thought, uh-oh, I'm in trouble. I says, what do you mean? He says, well, I've got 70 of those patients, and she's the only one that got better. What'd you do? And so we had a discussion, and then we found him a psychologist who did hypnosis that could see the other patients. But now remember that secondary gain? He had already disabledly retired over half of those people. The ones that he had already disabledly retired never got better. Many of the others did, because they had a secondary gain. They were getting money, they didn't have to go to work, they were happy. So that's something that you always have to be cognizant of, is there a reason they don't want to let this go? But then I get a question about patients, clients being resistant. And there's many things that you can do to work around that, but first of all you got to find out, why do they want to be resistant? What is it that they're afraid of? What is it that they want to happen? And you also have to realize that suggestions only become permanent with repetition. There's also getting a person into an alpha or a theta brainwave. We always talk about self-talk. But with self-talk doesn't really do a whole lot unless you allow your conscious mind to kind of move aside that critical factor, so that when you're having these thoughts are pure. And the only way to do that is in a meditative or a hypnotic state. So if you're going to say, I'm relaxed, I'm calm, and I'm at peace, but you're just saying it over and over without, okay, let me relax, and then I'm relaxed, I'm calm, and I'm at peace, well, that's going to be okay, except for one thing. And the Chinese were very smart about this. A picture is worth 1,000 words. So if you're going to give somebody an affirmation, they've got to have the picture to go with the affirmation. The subconscious mind, which I call the limbic system, or the limbic system I call the subconscious mind, works in pictures. 35% of your brain is made up of the visual cortex, so use those pictures. Focus on those pictures. And those pictures then are going to be determined by two other things. What is your expectation? And what is your perception? Everything based on perception. So when you change your perception, you change the body's response to certain things that are happening. So when we change those perceptions, we end up having a biology of change. And that biology of change then will allow us to change the mind, change the brain, which can then change the pain, or whatever behavior it is you want to change. But what other way can we say that? We say, okay, changing how you think changes the chemical responses of the brain, and that then will change whatever that behavior is, and now we're talking about pain. This is very specifically described when you watch the movie What in the Bleep Do We Know? So I highly recommend that. So hypnosis helps us if we study the why and how of hypnotic techniques that change the mind. And those are the things most of you are already using. Mindfulness things, deepening, stories, metaphors, biofeedback. Any of these are going to help you change how the brain is taking in that information. Hypnosis is evidence-based. That means it's been researched. It's a proven method to create change. Therefore, an effective adjunct to the pain community's armamentarium for pain management. You're going to become a part of that, not so much because they're going to call and say, hey, take care of my patients. Your patients are going to find you. Their patients, your clients will find you, because what they're getting for most of them is not working. They're addicted to drugs, but yet they're still hurting. They start with their family practice doctor, their general practitioner. They go to the pain doctor. Those who get better are good. But a huge majority of those are then sent back to their family practice doctor, who doesn't know what to do with them. That's why he sent them to the pain clinic to start with. So now he's back to prescribing opioids or other painkillers. Unfortunately, with the way so many people have gotten addicted, it's hard for them to even do that now. So even more than ever before, people are looking for something. And what we have to offer is a non-pharmacological relief from pain using hypnosis. The other things we have to be concerned about with patients are things like if they've had chronic pain, and keep in mind, if it's chronic pain, it's been for more than 6 months, that means that they do what we call catastrophizing. They want to make it worse. They want to talk about it all the time. But they also have this air of helplessness. And I don't know if you've ever felt helpless before or not, but can you imagine knowing that nobody can help you? So that makes it worse. The fact that nobody can help you makes it worse. The fact that you're helpless means there's nothing you can do. So hopefully those people that have gotten to that point can find you. What we want to do is to create for these people a new air of expectancy. Right now, they never expect to get any better. They just expect to get worse, worse, worse. They're not getting sleep, and sleep is the #1 criteria that you got to have for healing, because we heal while we're asleep. So therefore, they're not getting sleep, their body's not working right, and they're not getting better. Their immune system's not working because they're stressed. So everything is like a big snowball rolling downhill, getting worse and worse and bigger, and you can help them take care of that. Unfortunately, people who don't have pathology, in other words, if you don't see a wound they shouldn't be hurting, end up having things said to them, and you've probably heard it if you've had a client with chronic pain, where you're just going to have to learn to live with it. Well, the opposite of that would mean you're going to have to die. We also realize that nobody wants to listen to a complainer. Complainers are less deserving. So we don't want to be around those people because they make us feel bad. Now, we could say that nobody's ever died from the pain, but many have taken their lives and many have requested others to help them take their life. See, a pain experience is very multifocal. One of the things is it's physical. You feel it. It hurts. The other is it's psychological. You kind of lose concept. You're blurred with medications. Psychologically, you lose hope because nothing is working. And it's sociological. Your friends don't want to be around you. It takes so much money that now your family may be destitute. And it's spiritual. Why is God doing this to me? Why am I being punished? So these are the things that you will be addressing in hypnosis. Pain is sensory. We just talked about that. You feel it. It hurts. Pain is emotional. It makes you angry. It makes you mad. It makes you frustrated. It makes you catastrophize. Pain represents many things to different people. So one of the jobs you have is uncovering what does that pain mean to that person that you're seeing. Because you see, the pain itself destroys lives. It destroys families. It destroys bank accounts. It's expensive. So those are the things, and it makes people want to harm themselves. So you can be a lifesaver for many people, not just because they're not hurting anymore. You can help them bring their families back together. You can keep them, get their finances back in order. You are going to be so surprised at how much effect that you can have on a person's life. Because you see, pain is very soul-stealing, and you can make a huge difference in that. They have loss of control. They're helpless. Supposedly, chronic pain serves no real purpose, but it's serving some purpose. If it wasn't serving some purpose, it wouldn't be there. You are going to help uncover that purpose. We've already talked about it. Really reduces the quality of life. So keep that in mind. So we want to sum this up by saying, what does hypnosis do? It limits suffering. It preserves hope. It prevents debilitation. It improves their treatment compliance. They've still got to do their other treatments. They may not go to physical therapy because it hurts too bad. You can make that easier for them. We don't take away their medications. We never talk about those. All we talk about is the hypnosis. Everything else is between them and their physician. We also want to help them prevent impingement upon work, leisure, their role in their family, and their role in society. Those are the things that you, using hypnosis, can teach that client self-hypnosis and how to work in a very more comfortable manner. I've enjoyed talking to you. I'm at Healthy Visions. My website is healthyvisions.com, or you can email me at ron@eslinger.net. Hey, have a good self-hypnosis night. Take a good breath and allow yourself to relax, and only think positive thoughts, but think them in that self-hypnotic state. Have a great day. Thank you.